Advances in shoulder surgery allow for rotator cuff repair to be performed through small incisions in an outpatient setting. The rotator cuff is initially tested for mobility to allow for easy reapposition to the bone for the repair. A needle is utilized to locate the positions of anchors required for the repair. An awl is used to create a starter hole in the bone to facilitate anchor placement. In this patient, this is the first row of anchors to be applied. A 4.5 millimeter anchor is chosen. Anchors can be made of metal or, as in this case, a bioabsorbable material. They are then screwed into the bone. The sutures attached to the anchor will be used to repair the rotator cuff. In a tear this size, a second anchor is needed and is placed in the same fashion. Using specialized arthroscopic instrumentation, the sutures are passed through the rotator cuff tendon. The second limb of suture is also passed through. These sutures will eventually be tied to reoppose the tendon back to the bone and effectively repair the rotator cuff. Sutures from the second anchor are then passed using the same technique. For secure fixation, a second row of anchors are placed. Two anchors are placed in the second row. Sutures are again passed through the tendon. These sutures from the second row of anchors will help repair the outside edge of the rotator cuff. Sutures are also passed from the second anchor in the second row. Once all sutures are passed, they are then drawn through a cannula so that arthroscopic knots may be tied. These sutures that are passed from the second row of anchors are utilized to repair the outside edge of the rotator cuff. Sutures from each anchor are tied in a systematic fashion. Once all sutures from the second row of anchors are tied, an adequate repair of the outside edge of the tendon is visualized. The sutures that were initially passed from the first row of anchors are then retrieved and tied. This will lead to an effective double row repair of the rotator cuff tendon. A completed rotator cuff repair is then visualized. Thank you for your attention.